Good morning to you. I'm Teresa Dufour with the CT Style Express. As our state slowly reopens, patients will be returning to medical offices along with their staff. At the Fichman Eye Center, plenty of new practices are in place as they welcome back their patients. Here with all the details is owner Dr. Richard Fichman. Nice to see you, doctor. Thanks for chatting with us via Zoom.
Well, it's my pleasure.
First off, talk to me a little bit about what you specialize in.
Well, I am myself primarily a cataract surgeon. The practice sees everything from children to glasses to contact lenses, but I do primarily cataract surgery.
And how have your practices been different since the pandemic?
Well, we have to pay a lot of attention to making sure that it's safe for our staff and our patients. And so we've gone through our ventilation system, changed filters, cleaned everything. We use an industrial cleaning company that uses 15% bleach to wash down the walls, the chairs, the surfaces. We personally always sterilize every surface prior to each patient coming in. We have a concierge service so that you wait in your car. Your car is now your waiting room, and we come and get you, bring you right into an exam room. You stay in that room. You don't go to the waiting room. You don't have any guests with you, and that helps us keep in tune with social distancing.
Run me through the concierge. So we're not going to be in the waiting room. We're not going to have the magazines anymore. People are going to be in their car.
No, it's just a funny thing how the paradigm change is. You look at magazines and you go, oh my God, we can't have people touching magazines. So we took all the magazines out, and we want to take the stress off the waiting room. So by not having guests and by having people wait in their cars and then wait in the waiting room, there's going to be in a waiting room that might have had 25 people, there might be 2 or 3 people in it.
Wow, big difference. Lots of precautions being taken. Doctor, run me through what a visit is going to feel like for your patient now.
Well, again, they will register and let the staff know that they are there. If we don't already have their insurance information, we'll get that over the phone. We'll process that all. If we need to come to their car and get the insurance card, we'll get that. And then when their time to come is approaching, we will actually come to the car, motion them to come in the office. They will, of course, wear a mask. They've already been asked prior to the visit about their medical history, coughing, fever, abdominal problems, etc. And we will take their temperature, ask them those same questions again, and then escort them directly into the waiting room, which has been meticulously wiped down with FDA-approved products to make sure that there's no surfaces that are contaminated.
Sure. And let's talk a little bit about masks, because not everyone's wearing them the correct way.
Well, truly, if I had a nickel for every time somebody wore a mask the wrong way, we would be zooming on a helicopter to my private island in the Caribbean, but unfortunately that didn't exist. But nonetheless, here's how you put a mask on. Here's the mask. I'm going to loop it around my ears. I'm going to keep the bottom part underneath my chin, bring it up, and there's a stiff part here which I mold to fit around my nose. There's a seal here, and there's a pretty tight fit here. So I'm not getting any of the aerosolized stuff coming out of my lungs into the environment. And that's really how the virus spreads.
Sure, and that's so important that you wear the mask properly, have your mouth and your nose covered, or it kind of defeats the purpose.
It does. It does. I mean, certainly it's better than nothing, but if you do it the way I showed you and the other person has it that way, I've been told by my infectious disease specialist that it would be extraordinary for you to be able to either pass the virus on or to get the virus from someone else.
Sure. Well, Doc, it seems like you are ready for patients, ready for business.
I am, because we have a lot of patients that are anxious. I mean, the world has to go on, but we want to be very cognizant. My staff is very important to me, and the patients, of course, we have a sacred obligation to, and we want to make sure we're doing the very best that we can.
Sure, and tell us where your locations are.
We have one in Manchester, one in Torrington, one in New Britain, and one in the neighborhood I grew up in Hartford on Albany Avenue.
Wonderful. Of course, we could learn more over at FichmanEyeCenter.com. Doctor, it was so great to meet you. Thank you for all the practices that you have in place and for what you're doing for your patients.
Well, it's great. The helicopter will be by in about 20 minutes.
I'll be ready. I'll see you then.
Right.
Thanks, Doc.
My pleasure.